Hello everyone. In this class, we'll learn about hypoxia. Hypoxia is oxygen deficiency at tissue level. It is more relevant term than anoxia where rarely no oxygen is left in the tissues. Hypoxia is divided into four types. Hypoxic hypoxia, or also called as anoxic anoxia, anemic hypoxia, stagnant or ischemic hypoxia, where there is a decreased blood flow to the tissues and adequate oxygen is not delivered. And fourth one is histotoxic hypoxia, which occurs because of the action of a toxic agent and tissue cells cannot make use of oxygen here. Hypoxic hypoxia, it is characterized by a low arterial PO2 and oxygen carrying capacity of the blood, and the rate of blood flow to the tissues are normal or elevated. Hypoxic hypoxia is a problem in normal individuals at high altitude and is a complication of pneumonia and a variety of other diseases of respiratory system. Some of the causes for hypoxic hypoxia: low oxygen tension in the inspired air. The oxygen tension in the inspired air reduces at high altitude or while breathing air in closed space and also breathing a gas mixture containing low PO2. Can also occur because of the decreased pulmonary ventilation. Pulmonary ventilation decreases in the following conditions such as airway obstruction as in asthma, depression of respiratory centers by drugs such as morphine, and weakness and paralysis of respiratory muscles. Uh, and inadequate oxygenation of the uh, blood in lungs also leads to hypoxic hypoxia. Oxygenation of blood in the lungs reduces in following conditions, that is because of the impaired ventilation, impaired alveolar diffusion as in case of emphysema, and presence of non-functioning alveoli as it occurs in fibrosis. Some cardiac disorders like venous arterial shunts, where deoxygenated blood mixes with oxygenated blood, and it can happen in congestive heart failure. Anemic hypoxia. Here the arterial PO2 is normal, but the amount of hemoglobin to carry oxygen is reduced. It is a condition in which oxygen carrying capacity of the blood is reduced. The oxygen availability is normal, but the blood is not able to take up sufficient amount of oxygen due to the anemic condition. Some of the causes for anemic hypoxia are, it can be because of two reasons. One is quantitative deficiency of hemoglobin. For example, in anemia, here the oxygen carrying capacity is decreased due to the actual deficiency of hemoglobin. Other reason is qualitative deficiency of hemoglobin. For example, altered hemoglobin such as methemoglobin. Here the hemoglobin content is normal, but due to its altered nature, it cannot carry oxygen. This also includes carbon monoxide poisoning. The affinity of hemoglobin for carbon monoxide is 210 times its affinity for oxygen, and the carbon monoxide hemoglobin liberates carbon monoxide very slowly. The difficulty is that when carbo carboxyhemoglobin is present, the dissociation curve of the remaining HbO2 shifts to the left, decreasing the amount of oxygen to be released. The characteristic feature of anemic hypoxia is that partial pressure of oxygen of the arterial blood is normal, whereas oxygen carrying capacity of the blood is reduced. Stagnant hypoxia. This type of hypoxia, the blood flow to the tissue is so low that adequate oxygen is not delivered to them despite a normal arterial PO2 and hemoglobin concentration. So, arteriovenous oxygen concentration difference increases, thereby the reduced hemoglobin increases. Hypoxia due to slow circulation is a problem in organs such as kidneys and heart during shock. The liver, possibly the brain are damaged by the stagnant hypoxia in congestive heart failure. Causes for stagnant hypoxia: the velocity of blood flow decreases in the following conditions like congestive heart failure, hemorrhage, surgical shock, vasospasm, thrombosis, and embolism. Histotoxic hypoxia: hypoxia in which the amount of oxygenated oxygen delivered to the tissue is adequate, but because of the action of toxic agent, the tissue cells cannot make use of oxygen. It occurs due to the inhibition of tissue oxidase processes and the most commonly as a result of cyanide poisoning. Here, the cyanide inhibits cytochrome oxidase and possibly other enzymes. When cytochrome oxidase enzymes are inhibited, oxidation stops in the tissues. Oxygen from the capillary blood is not extracted, so PO2 of venous blood remains high. So, arteriovenous difference of oxygen decreases. Methylene blue or nitrates are used to treat cyanide poisoning. They act by forming methemoglobin, which then reacts with cyanide to form syn-methemoglobin, which is a non-toxic compound. Effect of hypoxia in various systems on blood. Hypoxia stimulates juxtaglomerular apparatus of kidney, increasing the secretion of erythropoietin. Erythropoietin stimulates the red bone marrow. RBC count increases with increase in reticulocyte count, and eventually oxygen carrying capacity of the blood is improved. On the cardiovascular system, hypoxia, except anemic hypoxia, stimulates peripheral chemoreceptors, which in turn stimulates cardiac and vasomotor centers. Thereby, there is an increase in heart rate, force of contraction, cardiac output, and systemic arterial blood pressure. Its effect on respiration. All types of hypoxia except anemic hypoxia stimulate peripheral chemoreceptors to increase respiration. The rate of increase in ventilation is in proportion to the severity of hypoxia at the peripheral chemoreceptors. On the central nervous system, in mild hypoxia, the symptoms are similar to the alcohol intoxication. That is, there can be depression, general loss of self control, headache, and loss of time sense. In severe hypoxia, there is a sudden loss of consciousness, and if not treated immediately, the coma occurs and it can lead to death. So, this chart shows the difference in all the four types of hypoxia, that is, hypoxic, anemic, stagnant, and histotoxic hypoxia. Hypoxic hypoxia can occur in high altitude sickness where uh, the partial alveolar and arterial and oxygen contents are reduced. In anemic hypoxia, for example, severe anemia, the alveolar and arterial PO2 are normal, but oxygen content is reduced. Where in stagnant hypoxia, the cause is left ventricular failure. Here, the alveolar, arterial, and oxygen content are normal, but the arteriovenous difference tremendously increases. Whereas in histotoxic hypoxia, where the cause is cyanide poisoning, the alveolar and arterial oxygen content may be normal, but the oxygen is not utilized, so the arteriovenous difference decreases rather. Treatment, that is, the important moderator treatment is oxygen therapy. The best treatment for hypoxia is oxygen therapy, that is uh, treating the affected person with oxygen, pure oxygen, uh, or oxygen combined with another gas is administered. Depending on the basic physiological principles of different types of hypoxia, the valuability of oxygen therapy in various types can be understood. In hypoxic hypoxia, oxygen therapy can completely correct the depressed oxygen level in the inspired gases and therefore provide 100% effective therapy. Hypoventilation hypoxia. Here, the oxygen therapy, the amount of oxygen entering the alveoli with each breath can be increased. But this provides no benefit for the excess blood carbon dioxide. Uh, this is no benefit for the excess blood carbon dioxide also caused by hypoventilation. In hypoxic hypoxia caused by anemia, abnormal hemoglobin, transport of oxygen, circulatory deficiency, or physiological shunt, the oxygen therapy is of much less value because normal oxygen is already available in the alveoli. In hypoxia caused by inadequate tissue use of oxygen, that is in histotoxic hypoxia, oxygen therapy is of practically no value because here neither oxygen is picked up by the lungs. Here neither oxygen picked up by the lungs or transport to the tissue is deficient. The defect is in the tissue metabolic system, so it cannot utilize the oxygen which is being delivered. This is all about different types of hypoxia in brief. Thank you.